All right, we are now recording. Hello, everybody. My name is Tiffany, and I am the program manager of our Patient and Family Advisor program at the SCCA. And today I'm kicking us off with our SCCA Advisor Program Patient and Caregiver panel by giving an overview about who advisors are and then introduce our lovely panelists for today. So advisors are patients and caregivers who volunteer as a resource at the SCCA. They serve on committees and projects and sit on our Patient and Family Advisory Council. The role of our advisors is to improve the communication between staff, patients, families, and provide input in the development, implementation, and evaluation of SCCA programs, policies, and services. Joined with me today is Steve, Katie, Carly, and Kaylee, and they will be sharing their experiences as patients at the SCCA, why they joined the advisor program, and what they most enjoy about the advisor program at the SCCA. And so I would love to invite Kaylee at this time to share more about her, or to share her story and how she came to be a patient at the SCCA.
Thank you, Tiffany. It's great to be with you all today. My journey to SCCA and to becoming a cancer patient is like a lot of others. It was one that was winding and unexpected. I was diagnosed at the time that I was 27 years old. I had just landed my dream job as general counsel of a corporation. I was playing tennis 4 to 5 days a week, somewhat competitively with USTA in my spare time outside of work, and just really felt like I was kind of at one of those just very happy moments in my life. I was living in North Carolina where there's, a lot of plant life, really lush, very beautiful. I have very bad allergies. And of course, playing tennis and being outside so much, I didn't really think anything of the fact that I had what I would joke and call my neck balls throughout the course of 2014. Whenever I went to one of my annual physicals, I asked my gynecologist, hey, can you check out what these neck balls are? And she looked at me like, what are you saying, lady? But she felt them and she was like, I'm glad you showed those to me. I'm going to refer you over to a surgeon to find out what they are. I've looked at your blood work. I have no concerns, but let's just be cautious and, go ahead and get an answer as to whether it is related to your allergies or something else. So I went through the course of a couple of months' journeys of going to the surgeon for the first time. He again reiterated everything that my gynecologist said. You're very healthy, you're young. I think it's probably nothing serious, but let's go ahead and start a series of tests to see what it is. I started with blood work, a couple of scans, a core biopsy, an excisional biopsy, and within the course of 2 months, I went from being, oh, you're perfectly healthy, you're 27 years old, to the day after I turned 28, I was diagnosed with diffuse large B-cell lymphoma unexpectedly. I, of course, was just absolutely devastated and confused as to how that could happen. I had no risk factors. There was nothing that would have predicted that I would have developed that type of aggressive lymphoma. And then, of course, I started looking for where is the best place that I can be treated. As I said, I was living in North Carolina, so I looked around hospitals actually across the nation, and in my search, I looked at many of the reputable institutions, and at that point decided that UNC was going to be the best place that I could be treated. They had a clinical trial that would help be able to negate some of the effects of the traditional course of chemotherapy for that type of lymphoma, and so I enrolled in the trial there. Throughout my cancer diagnosis and treatment, I ended up moving to Seattle. And part of my decision to move, I was looking for a city that was going to have another cancer program that was of high quality. And in that, SCCA was clearly in one of the top 5 in the nation based on the quality of care, the amount of research, and just the overall reputation of the institution. And so whenever I was looking for the move, I actually wanted to stay under the care of my clinical trial. And fortuitously enough, the trial that I was being treated under at UNC was also happening at SCCA. And not only did they have the same trial so I could easily transfer, but there was also a unique connection that my oncologist at UNC had actually done his fellowship training with my oncologist at SCCA. So I was able to transfer out here, continue my care and follow up, and I've now been in remission for over 5 years now.
Thank you so much, Kaylee, for sharing your story. And again, congratulations on the 5 years. So happy to hear it. I would love to ask Steve to share his story and take it away, Steve.
All right, thanks, Tiffany. And I'm really happy to be here. Yeah, you'll probably hear some similar stories from a lot of the patients at SCCA. So mine is a little bit similar to Kaylee's. I was living in Seattle, single, living downtown, working and really enjoying life, very active. I was a long distance runner. So that's what I enjoyed doing for exercise as well as for stress relief. And so just kind of going around life like everyone does. And a couple of incidents kind of caused a bit of a change in my life. One was that I, had been a runner. I'd kind of banged my knee up, kind of overdone it a little bit. So I hadn't run for probably around 9 months or so. Once my knee was better, I started running again. But I couldn't go more than a few blocks and I got tired. And I thought, boy, turn 50, everything goes downhill. So I just kind of thought, well, I just need to kind of keep building up my stamina. Another incident happened is the bloodmobile came up to work, and I used to give every 8 weeks and donate blood. But I hadn't donated in about a year because I'd taken a trip to China and had gone to some rural areas of China, and they don't, like you to donate blood for a year or so after you get back. So a year had gone by, so the bloodmobile came, and me and my coworkers, we marched out there like normal, and they do the thing with the blood where they prick your finger, and kind of test your blood, your red blood cells first. Well, they did that twice, and the technician said, I can't even tell that you have red blood cells. And she said, the next time you're at your doctor, you might want to ask him about that. Well, I immediately made an appointment and went in, and my doctor, my primary care doctor, she examined me and she said, you look great. Everything seems fine. Let's just go ahead and do a full blood test just to be sure. So we did that. And then something happened that hadn't ever happened to me before. The doctor herself called me at 8 a.m. the next morning and pretty much said, I need you in the office today, and you may be in the hospital tonight. So that was a little bit of a wake-up call. I went in, and as it turns out, all 3 of my blood cell levels were low. Now, luckily, they were not, going down. They were pretty stable, but low. But it took about 3 to 4 months for it to be diagnosed as a type of blood cancer called myelodysplasia, or MDS. And my hematologist had done, it was part of his rotation through Seattle Cancer Care Alliance, and said, you know what, I want you to go talk to them. So I went over and did a consultation with SCCA and was extremely impressed. They just, blood cancer is one of their specialties, among other things. And I was really impressed with the people. So I decided, that's where I wanted to get my treatment. Now, interestingly enough, my family is mostly in Texas, and MD Anderson down in Texas is the place you go. And so they were saying that that's where I needed to go for treatment. But interestingly enough, my niece was in school to be a physician's assistant, and she went and talked to her hematologist at Texas Tech University, and he said, no, he needs to go to SCCA. So that's where I decided to go. And I underwent a bone marrow transplant in October of 2010, which completely cured me of my MDS. And so I guess I celebrated last month, I celebrated my 11-year anniversary. So that's how I got to SCCA.
Thank you so much, Steve. And also congratulations on the 11-year anniversary. Wow, time is flying by, and so glad that you have been volunteering as an advisor for quite some time. And I would love to hear from Carly to share her experience about coming to the SCCA.
Thank you, Tiffany. Pardon my voice. I have a little allergies going on here, so apologize. I think it's interesting to hear the similarities in everybody's story. I was 34 years old, had grown my accounting firm to gigantic levels. I was in this beautiful spot in my life. I thought I had it all. And in 2012 Christmas, my body just started to change. I wasn't the same person I was. One of the first things actually is I started getting angry for no reason. My family says that my personality that Christmas just really changed. And, we thought it was just stress, life things. Everybody was patient with me. But June of 2013, I'm an avid water person. I love boats and kayaking and swimming. And I had started the kayaking season, and I had been carrying my kayak on my left side on a sling. And so if you're familiar with that, it causes your watercraft to kind of hit against your side a little bit. And I had noticed a bluish tone lump on that side. So I went into the doctor and I said, hey, I have this thing. I don't know what it is. This is what's changed. And after a series of appointments and misdiagnosis, I finally ran across a physician assistant that his bottom line answer to me was, this doesn't look like it belongs there, so maybe we should look at it. And that simplistic question for a 34-year-old woman changed the trajectory of my whole life. He actually cared about me enough to walk me across the hall to a general surgeon, take that general surgeon out of an appointment, and a week later, I was having it removed, and 30 days later, I was in treatment. It happened very, very quickly. I ended up at SCCA because my current healthcare provider didn't have a billing code for Ewing sarcoma, which is the type of bone cancer that I had. I really didn't have any familiarity with the SCCA because I was going through such shock of what was happening to me. I don't think I was processing really at that point, like, where's the best place to go? All I could think about is that yesterday I was fine and now I'm not. So I ended up at SCCA just through a blessing of events in my life. And I remember when I first got to SCCA, the story of why I was an outlier of Ewing sarcoma. I was a non-pediatric patient. I was a woman. I have soft tissue sarcoma versus a bone tumor. The decision to be there, while not necessarily of my own, was truly the best place for me to be. I'm 7 years out of treatment. Ewing sarcoma doesn't have remission or like they don't, there's nothing like it's a terminal diagnosis, so you don't get to a remission point. But I've been in NAD for 7 years. I anticipate to be there a long time. I can live in NAD status for a long time, but it sure is a blessing to be involved with SCCA, that if I ever do need to come back, that they're ready and willing to help me. So thank you for having me.
Thank you, Carly, so much. And I say this for all of us, that we continue to have 7 more extra all of the years to come in ND. And actually, I'd love to have Katie share her story, because again, bringing on and touching upon all the similarities, I think Katie's story will be really interesting. Katie?
Thank you, Tiffany, and thank you for having this panel. My story is the complete opposite of everyone else's. I did not have any suspicious lumps or bumps. I did not have any fatigue or tenderness or nerve pain, or I had 0 symptoms whatsoever. My diagnosis was actually the result of an incidental finding on an abdominal CT. So, I had been having some abdominal issues for several days in 2019, and I had called my primary care provider to schedule an appointment. And the triage nurse was like, okay, unfortunately, we can't get you in, for another week. But if this has been going on for several days, I would recommend you go to the ER. And I was like, that's ridiculous. This is not emergent. It's not even urgent. I'm not going to waste those resources. And I ended up having a phone call with my parents that same day, and they were like, truly, if she suggested that, maybe you should go. So I finally gave in, and I went to the ER, and they were like, okay, let's do some tests, and let's do an abdominal CT just to make sure everything is working right. So completely unrelated to those issues that had sent me to the ER, the radiologist found what was already about a 7-centimeter solid tumor in, of all places, my left butt cheek. So he came into the room after he got the results, and he was like, let's talk about this mass in your glute. And I'm like, what mass? So right from the start, I was told that they could not rule out sarcoma. So from that moment, I sort of prepared myself in where do we go from here. My primary care provider ordered a follow-up scan, and she actually gave me a referral to a general surgeon, but I was already doing my own research on sarcoma, and I knew even early on, sometimes you have to be very careful how you do even just a biopsy with sarcoma. So I have worked at UW Medical Center since 2015, and it was not even a question that I was going to SCCA for treatment. I was very proactive in finding my own care. I literally called the sarcoma clinic at SCCA and I said, I don't even have a diagnosis yet. We haven't even done a biopsy. I have zero, evidence that I actually have sarcoma, but can you help in case that is what it is? And they were like, yeah. And I had an appointment scheduled about a week and a half later. And it turns out it was indeed sarcoma. It's a really rare kind of sarcoma called mesenchymal chondrosarcoma. It's actually so rare, there have been less than 1,000 cases ever documented. So trying to navigate a relatively unknown cancer and how that works out in treatment was kind of a wild ride for my team. So I did surgery, radiation, chemotherapy, and it's been just about a year now since I have been NED like Carly. I have had a little bout with a skin cancer since then, but kind of small potatoes in comparison to the big bad one. So like I said, it was never a question that I was going to come to SCCA for my treatment. I already knew just how wonderful and innovative and amazing the program was. And I was really impressed that every member of my care team, their pedigree and resume, everyone was more impressive than the next. So I didn't have any doubts in my mind that I was in the right place for treatment.
Thank you so much for sharing your story, Katie. And just want to call out the unique position you all are in, and to understand when Katie says having another cancer is small potatoes compared to a different cancer. So that really speaks volumes to all of your experiences and just your individual journey and really understanding you can go through radiation, chemo, and all of that, and then have something else. That bring it on attitude is something that I know that you all have. And I think that leads me into the next question that I would actually love Steve to kind of kick us off on is, why did you decide to become an advisor? Cancer is not easy. It's a very scary journey for a lot of people. You're part of this club that you did not ask to join. And why serve at the SCCA as an advisor? Steve?
Yeah, I think that's a good question. Interestingly enough, when I, was diagnosed and I knew I was going to be going through treatment, I had a totally different impression of what it would be like at SCCA. I expected to come in and it would be dark and it would be sad and it would be a really, just a very kind of down atmosphere. And that's totally different than what it really is. I mean, it's interesting going in because everyone is in a good mood. And I don't mean that in a bad way. I mean, everyone knows that this is a serious place and there's serious things going on, but it's such a positive atmosphere. When I was first going through treatment, I was with one of my friends who brought me in for my treatment. And I noticed that there were some volunteers, in the area. And I said, oh my gosh, I could never volunteer at a cancer place. Cancer treatment place. I just couldn't do that. But I'll be honest with you, when I was done with my treatment, that's the first thing I wanted to do. I received such wonderful care at SCCA. And although it, by far was the hardest thing I've ever done in my life, it was a very difficult time to go through the type of treatment that I went through. The staff there made it just unbelievable. It just is phenomenal. And, like any other human endeavor, there's always room for improvement. And one of the things that I noticed there that SCCA was very focused on the patient and family, the caregiver experience. And so when I finished treatment, I said, I want to help out. I want to make this even better than it already is. And that's why I decided to volunteer at SCCA.
Thank you so much, Steve. And we are so glad that you changed your position from when you were in treatment to feeling compelled to volunteer with us after. What about you, Carly? And yours is interesting because I actually, well, how about you, Carly? I'll let you answer that question.
So, so I guess it is a little bit different. I had really no involvement with SCCA in my 7 years since leaving. I was and I will continue to always be active on Facebook Ewing sarcoma groups. Like Katie, when you have a rare cancer, you really have to find those places where you can connect with people, and the online community is someplace I was able to. So I had been very active in talking with people in that arena, but Tiffany actually reached out to me and was referred by my oncologist to do a panel. And that was such an amazing experience. I thought it was just going to be this one-time thing, huge blessing in my life, and then we'd all say that was fun and we'd move on. But from that, actually developed the relationship on a completely different level with SCCA. Why I decided to join the panel is there were so many times in treatment I didn't know the answers. I felt so lost. I felt so alone. And whether it was just somebody walking in the hall at SCCA that said hi, or my doctor calling just to see how I was doing, or the caregivers saying, it's going to be all right. It was those little things that mattered to me every step of the way. And being able to be a part of a resources in change for that needs to happen. Like Steve said, SCC is amazing, but there's always room for improvement. There's always room for growth. And if I can do one thing to help somebody else, it'll all be worth it. Because there were times I didn't even know the answers, no less than even the questions to ask. So being part of the solution for the next group of folks that are coming through is key to my involvement.
Thank you so much, Carly. And I'm so glad that you said yes when I invited you to participate. Katie, what about you? Why did you decide to join?
So at UW Medical Center, I work in patient and family education and patient and family centered care. So my department oversees our patient and family advisor councils. And so I have been to those council meetings at UW, and I've seen the amazing, collaboration that comes from the staff and the patients and caregivers. So I wasn't even out of radiation when I reached out to join the SCCA PFAC, because I was like, why would I not, share my experiences, both as a patient and having been a staff member working with a PFAC. And so kind of like getting my care at SCCA, it was a no-brainer for me to share my experiences and to do what I could do from a patient standpoint to help improve care for other patients.
That's right, Katie. I forgot that you were still in treatment when you and I had spoken. And I remember that so vividly. And I actually forgot that part because we were just chatting and talking. So again, so glad that at that time you were ready to serve. And Kaylee, why did you decide to join?
So I decided to become an advisor because it was driven from the understanding and the feeling that as a cancer survivor, I really found a new appreciation for life. I've always been someone who's very enthusiastic about just about everything that I do. And I've always wanted to be able to utilize my experience, utilize my knowledge, utilize my time to be able to help improve outcomes for other people. And in my experience at SCCA, much like Steve noted, the people there are honestly just a ray of light, even when faced with difficult circumstances, with unknown solutions, maybe with unknown issues that they're trying to address. It's really an institution that stands out in my mind as putting the patient at the center. And in that, I wanted to think about how could I utilize what I fortunately had overwhelmingly positive experiences at both institutions where I was treated, but how could I use the good experiences and some of the bad to think about how can I help the next patient, their next this next family member that's sitting there worrying about, are they going to get to make it to their 30th birthday? Are they going to get to make it through treatment? Are they going to have an option for treatment that will help them be able to successfully overcome their cancer, whether they live their life like Katie and as no evidence of disease, or whether it's like me and Steve, where we get to say we've been in remission for years now. And so my experience as an advisor gives me the opportunity to leverage my experiences that I had as a patient, some that I've had as being a caregiver for family members and friends that have battled cancer or other terminal illnesses, and think about how I can use that to collaborate with other people that serve on the PFAC and collaborate with the staff that truly value the voice of the patient and of the caregiver.
Thank you so much, Kaylee. And one question that I wanted to ask all of you, and I would love to hear Carly maybe kick us off, is what is your favorite part about being an advisor? What do you enjoy the most? Or what has been your favorite advisor activities?
I would definitely say that being a council member it's so powerful to be among survivors. And that has been a new experience for me. I'm in my family, I'm one of the only people to have a cancer. They love me, but they don't get it, if that makes sense. And I think a lot of survivors understand that. So being among a group of powerful people that have been through crazy things has been amazing. It's also a blessing to be around the caregivers in our group, where their focus and their passion is survivorship. We can share the stories, we can connect, and we can all come together in a way to where we can change the future of cancer treatment or the future of providing care for people with cancer. Being a mover in that environment with SCCA has been a huge blessing in my life.
Thank you so much, Carly. What about you, Katie? What do you enjoy the most about being an advisor?
I would say one, doing these panels, truly, and getting to not only share my story, but to hear the stories of my colleagues in the PFAC is wonderful. And I hope that, you know, whether you are a patient yourself or a caregiver or a physician or anything, that you are really taking to heart our stories and realizing what a huge impact the PFAC can have. I would say I also, I work on the patient communication work group as a committee project. And we sort of revise and review all of the documents that go out to patients, whether that's an email or a letter in the mail, or a MyChart alert even. So seeing the fruits of your labor is very nice, that it is very much a collaborative effort. That, you know, when I say, hey, from a patient standpoint, I would really avoid using this language, or it might be better to phrase it like this, and to see those changes actually being implemented, as opposed to, oh yeah, that's a good idea. But that's wonderful to know how valued my opinion is as a patient, and to see those changes being made in real time. I mean, sometimes you're turning around and that email goes out the next day and you're like, hey, I said to put that line in. That's great. I'm glad they took that. So yeah, those are some of my favorite things about being an advisor.
Thank you so much, Katie. And what about you, Kaylee? What do you enjoy about being an advisor?
I love being an advisor at SCCA for so many reasons. As an advisor, and I've been on the PFAC for about 3.5 years now, I've really gotten to see how SCCA as an organization lives and breathes, and how it is so special. SCCA, as I mentioned, is built on the minds and the heart and the sweat equity of all of the employees throughout the organization, whether it's someone in billing and accounting that are thinking about how to take the stresses of paying for your health care off of the patient and their family so you can focus on just your treatment and becoming healthy, or whether it's working with the care teams and thinking about how they're developing processes and procedures in a way that will make your care process fluid and help prevent any missteps that can occur in a health organization. It's an opportunity to really get to understand how dynamic of an organization it is, and the collaboration with Fred Hutch and bringing in innovative resources and research to help change the care of cancer for patients current and future. It's really just an amazing experience to get to understand how SCCA is really differentiated as an institution, and not only providing cancer care, but having patients be a part of their care and be able to be their own advocates, to be able to be a voice in determining how they can have their best outcome and best quality of life while they're going through treatment and beyond. Some of my favorite activities, so not only do I get to sit on the PFAC, but I also get to serve on the Patient Safety Council, which is a collaboration across about 3 dozen or so members of SCCA staff across various departments that look at patient safety outcomes and opportunities to improve the safety and delivery of care for patients. And I meet with that council on a bi-monthly basis. And it's really amazing to me that all of the doctors, the clinicians, the nursing staff, people that are coming from a policy perspective, really want to utilize my perspective in thinking about how they continue to evolve the organization and the quality of care and improve it and make it what is going to be the next generation of cancer care for patients like all of us. It's really just an incredibly rewarding opportunity, and one where I am blown away by the level of dedication and thoughtfulness that exists in every single person that works at SCCA.
Thank you so much. And thanks for reminding folks too about the Patient Safety Council. Not an easy feat to bring all these groups together, but again, for an organization like us who are truly committed to patient safety, I'm super happy that you are part of that council, Kaylee. Thank you. And lastly, Steve, what is your favorite part about being an advisor?
Yeah, similar to some of the other comments, similar to Kaylee's, that there's a lot of reasons that I enjoy doing this. And similar to what Katie said too, one of the things that I've really been impressed with is it's not just lip service. When that SCCA really wants to hear from patients and families, and most importantly, they take those comments and they actually implement them. It's not just a matter of, yeah, thanks for your input and we're going to go this other way. They really take what we say and try to integrate that into how they run the clinic and actually make changes based on what patients and families say and suggest. And I think that's extraordinary. So that's kind of one of the things. And then, Kaylee mentions one of the committees that she's on. One of the ones that I'm on is the Board Quality Committee. So that's actually one of the committees of the Board of Directors of SCCA. And they have 2 patients on that committee, which is just outstanding. So that's at some of the highest levels. They want to get patient and family input. And it's interesting, I'm on there with another patient, for a patient named Emily. And she's always made the comment, she says, whenever we have something to say, everyone stops and listens and really takes it to heart. And I think that's what makes it so rewarding for me, is they really value the input. And one of the kind of unique experiences, one of the things I really enjoyed is that SCCA is building a new building. And they also said at the very beginning of that process, we want to have a couple of patients and caregivers on the committee to design how that building is going to be built, how it's going to be run, how the care is going to be delivered. So they bring in patient and family perspectives in everything they do at SCCA. And that's why I do it, because I feel like what I do and the volunteer time that I give really matters and makes a difference.
Thank you so much, Steve. And I just want to say thank you to everybody who was part of our panel today. Steve and Katie and Carly and Kaylee, thank you so much for being advisors with the SCCA, for sitting on our Patient and Family Advisory Council, and just sharing your experiences and stories. And for those who are tuning in and watching this video, check out the Patient and Family Advisor Program website. That's on SCCA's website. Just click search for Patient and Family Advisors to learn a little bit more. And just looking forward to connecting with anybody who's interested in joining or learning more about the program. Thanks, everyone. Take care and hope you have a great rest of your day.